Good evening. Hope you all are doing well. I'm Dr. Rashmi Jain. I'm a general pediatrician practicing Concierge Pediatrics in Irvine. I'm a former Chalk graduate, so happy to be here in Orange County taking care of lots of babies. A little bit about me, I guess. I graduated from Chalk back in 2005 and was chief resident there 0506. So I've been practicing pediatrics for a while. I was out of state for a while, but I'm happy to be back. And part of my concierge practice actually does focus on spending a lot of time with families, being accessible to them 24/7, kind of being available to you guys evenings, weekends with all your questions. So this is kind of a fun topic for me, bringing baby home, because that's when I find I spend a lot of time with new mamas, first-time mamas, mamas who just have a lot of questions, and as you should. This is kind of one thing you, no matter how much you're prepared for, can never really be prepared. So let's dive in. Let's talk about bringing the baby home. So you've gotten to the hospital, you've had the baby, and now you bring the baby home. So let's get started. Congratulations. One of the first things I tell you guys is this is probably the steepest on-the-job training curve you're ever going to experience. So parents, you guys are figuring out how to be parents. You're figuring out how to deal with sleepless nights. You're figuring out how to deal with a baby who cannot tell you what they want, but they want so much. And it's serious on-the-job training for the baby. So baby has just come out of the womb. Mama, you've been doing everything for this baby till now. You've been taking care of the baby, feeding the baby through the womb, everything. And now all of a sudden the baby's out in the real world and has to do a lot for himself or herself. So serious on-the-job training for the baby, serious on-the-job training for you guys, a lot of learning each other and learning a new world together. So get prepared for that. The first month is pretty intense, a little roller coaster-like, but it's a real fun ride. Baby hasn't read a single book or blog, so I like to tell my mommies and daddies, no matter how many books you read, I guarantee you the baby hasn't read one. So the baby's going to do things the way the baby thinks the baby should. Sometimes it's a little bit like you've heard, sometimes it's not quite like you heard, and that's where we come into play. As pediatricians, we've seen a lot of babies, and sometimes we're able to tell you this is completely normal. Sometimes if they're not, we're able to tell you that too. So hang tight if it sounds like the baby is not following the rules that you saw in the book. The baby doesn't know the rules. So he's kind of doing things the way he wants. Take care of yourself. So that's another thing I tell all new mommies and daddies. Mamas, you've got to get your sleep. You've got to make sure you're eating and drinking. Got to make sure you're increasing that fluid intake. We'll talk about that in a second. And increasing that nutrition because you're also feeding the baby. And I remind you to give yourself some grace. Remember, the baby doesn't know if you're doing it perfectly or adequately or mediocre. The baby just knows that the baby's loved. So taking care of the baby, loving the baby, and taking care of yourself, give yourself some grace, cut yourself some slack. And this is a great, great time to kind of bond with your new precious little one. Call us when you have questions. Call your pediatrician. Do not hesitate. We expect that. We actually get a little nervous when you don't call us. So we want to make sure that you're asking your questions of the right resource so that you get the right information and more adequate medical information as opposed to opinions and misinformation that may be out there. So first topic that I like to talk about with all newborns is breastfeeding. Everybody wants to do it. Everybody's learned about it. Everybody's read about it. Everybody's gung-ho about it. But by golly, it's not easy. It is not. So with breastfeeding, there's a lot of questions that come up. And I want you guys to ask your questions as we're going along. I've kind of set this up in different topics, so feel free to submit your questions and we'll talk about them in the topic or towards the end, whatever you'd like. But some of the questions that do come up with breastfeeding are, when does breast milk come in? So some mamas are wondering, isn't it supposed to be here already? I just had the baby. So you got to remember, right now, until you have the baby, your hormones are saying, I'm pregnant, don't produce breast milk yet. So those pregnancy hormones after delivery go down, and then the breast milk hormones go up, prolactin rises, everything else rises. So this factory in your brain has got to start going. It's got to start saying, okay, production time, production time. That often takes 3 to 4 days for a first-time mama. If you've had a C-section, if there's been any type of medical issues at the time of delivery, say a little bit of blood loss, say you ended up needing more support than anticipated, sometimes that can delay your breast milk production. The key is to stimulate, right? The more we stimulate, the faster you'll come in. You all have heard about colostrum. Colostrum is that liquid gold, high fat, high protein. It's already there and waiting. It helps to get the baby to the point of when your milk comes in, but it takes a little bit of work. So plan on milk coming in by 3 to 5 days, not immediately. A lot of work for you and the baby, but you will get there. Is any latch a good latch? So when you're in the hospital, you may have worked with, or you may work with, if you're going to be having the baby, a lactation nurse who will work on the latch with you. So the question is, what's the big deal? Put the baby on, get the baby to latch. Well, the baby has to actually feel stimulation 2/3 of the way back along the upper palate. So if you run your tongue along the top of your mouth, where the hard palate turns to soft palate, kind of way back there, that's where the baby has to feel stimulation in order to start suckling. So that means mommies who have good nipples that protrude well have a little bit of an easier time, still have to get the baby on for the latch, but a mommy who has flat or inverted nipples may have to do a little bit more work. We may have to work with the lactation nurse. We may have to use a nipple shield for a little bit. Those are things that I don't necessarily say we need to think about in the first 24 hours, but in the first 2 to 3 days or 3 to 4 days, when you feel like we've started working with this, it seems like some things are working better than others, we have to remember that not every latch is a good latch. If the baby has a shallow latch, if the baby has a tongue tie that's affecting the latch, not all tongue ties affect latches, but some do. If the mama has flat or inverted nipples, it takes a little bit of work and may take a little bit of assistance. So don't be disheartened. We can work with that. There's a lot of people there to support you, between your pediatrician, between your lactation nurses, between a lot of mamas who've already had babies. Does a breastfed baby need formula? So we come into this thinking, we're going to make the milk, we're going to feed the baby. We don't need formula. And so what happens initially sometimes is a little bit of formula may suffice as a bridge, sometimes if the baby needs something before your milk comes in. So let's say you ended up having a C-section, you didn't anticipate it. Let's say you lost a little bit of blood and ended up a little bit anemic. Or let's say you're just in a lot of pain. Pain can actually keep you from producing your breast milk as well. Your brain can only do one thing at a time. It can either focus on the pain or focus on milk production or focus on being tired or focus on being stressed. So there's a lot of things that your brain has to not focus on in order to focus on producing breast milk. So sometimes initially it does not mean that you're deficient or that you're not doing a great job, but sometimes we may recommend small amounts of formula as a bridge until your milk comes in. Let's say your milk doesn't come in. There are some mommies who don't produce. There are some mommies who have a harder time with the latch. There are some babies who can't tolerate breast milk. So sometimes we end up doing a mix and match. We end up doing maybe 50-50, 70-30, 60-40. I will never tell you that, and most of us pediatricians won't tell you, that you have to do it all or none. There is no all or none here. The idea is to make sure your baby has the nutrition that they need. So does a breastfed baby need formula? Sometimes, and it's okay if they do. When should breastfeeding be initiated? This is an interesting question. So studies out there have shown that if the baby has skin to skin and does a latch and starts breastfeeding within the first hour of birth, there is a super increased chance of effective breastfeeding down the road. So that is why you may notice, or you may have heard, that immediately, once the baby comes out, they're working on getting the baby onto you, working on latching the baby, even before anything else happens. The idea is to help the baby and mama bond, create that latch, and start suckling. Because that creates that bond, also starts stimulating that factory and gets a little bit of that colostrum, high fat, high protein to the baby. So breastfeeding should be initiated within the first hour of life. Baby's not getting a lot of volume of liquid, but the baby's getting a lot of good stuff and a lot of connection with the mama, as are you, mama. So this is a good thing. And we have a question. We're going to go ahead and take that. If my nipples are cracked and bleeding, should I pause breastfeeding to avoid passing on bacteria to the baby? Is pumped breast milk still safe for the baby to drink? So this is a great question because you're right. We're not robots. We are going to have cracked, bleeding nipples. It is going to hurt for a little bit until our milk comes in, until the baby has a nicer latch, until the baby figures things out. So if you have cracked or bleeding nipples, you want to use your lanolin, you want to use your nipple butter. You want to remember that a baby doesn't need to be latched for a very long period of time. Sometimes we feel if we go longer, the baby's going to get more. So usually until your milk comes in, when you're still dealing with those first few days and colostrum, I recommend no more than 20 to 30 minutes. Once your milk does come in and the baby's swallowing and you're hearing it and the liquid is in, probably no more than 15 to 20 minutes per side. A baby's able to get out the majority. So anything after that becomes a little bit of a pacifying. So cracked and bleeding nipples, you want to use your lubricants to kind of help moisturize. You can pause breastfeeding for a couple times and go ahead and pump because it's not as strong with the pump. The baby's able to really suckle and dry out your nipples a little bit more. And your pumped breast milk is still absolutely safe for the baby to drink. You're not going to pass on a lot of bacteria or anything that the baby hasn't already come into contact with by suckling on your nipples before. So I'm not worried about infection. We're not worried about even a little bit of a droplet of blood that may go through. Remember, the baby came from within you, so the baby's used to everything you've got. But just remember, heal so that you can continue to feed. We don't want you to be in pain while you're feeding. So that's a good idea, to pump and feed the baby, and it's very safe for the baby to do so. Great question. I like that. All right, so breastfeeding, it is what we all talk about. It is really not as easy as we think it should be, but it is so gratifying and so wonderful. So we talk about that. And then we talk about formula feeding, because what is breastfeeding if we don't talk about formula feeding? So a lot of families think that formula is not as good as breast milk. So the first question that comes up is, does formula have the same nutrients as breast milk? Absolutely. Formula companies have worked long and hard to make sure that the content of nutrition is exactly what the babies need. Fats, proteins, carbohydrates, vitamins, minerals, iron, calcium. Everything is in there to be nutritionally appropriate for your baby. So there may be different sources of where those nutrients come from, but the nutrients that the baby gets through formula are 100% what the baby needs from a biological standpoint to grow and develop well. So that's as far as nutrients go. Formula comes with a lot of other factors. There's ready to feed, there's concentrate, but then there's powder formula, right? So you may hear, how should I mix my formula? Should I use distilled water, nursery water, bottled water, tap water, refrigerator filtered water? What should I use? So generally, we recommend using nursery water or distilled water, recommend using bottled water, and that's because of different things that can come in tap water. So there's sediments, there's minerals, there may be bacteria, viruses, different things that may come in small amounts that can be problematic. You can use tap water though. Not every country in the world is blessed to have gallonfuls of nursery water and distilled water sitting around. So in those situations, if you do use tap water, we boil it. You boil it, you get it to a good boil, and then you cool it for about half an hour, getting it to about 160 degrees Fahrenheit or 70 degrees Celsius. You mix the formula in at that 70 degree temperature, 70 degrees Celsius or 160 degree Fahrenheit temperature. You cool it under a cool tap, and you give it to the baby. So the idea is if there is any contaminant in the powder by any means, it will be killed at that temperature of 160 degrees Fahrenheit. You're going to cool it down though, because that is still too hot for the baby. Baby at most is used to drinking body temperature milk, so 98.6 degrees Fahrenheit if you think about it. So we cool it under a tap and then we give it to the baby, but it is fine to use boiled water that kind of distills it in that manner. Can powder formula be stored once mixed? So sometimes it seems it's like a chore to keep making 2-ounce bottles and 2-ounce bottles and 2-ounce bottles all day long, but you can actually mix up powder formula and keep it in the fridge for 24 hours. So let's say you make 6 to 8 ounces, keep it in the fridge. You pour out what you need at the time of a feed. You warm that up, never in a microwave, never directly on the stove top, always in another source. So usually a warm water bowl. So you warm the water up on the stove top. You take the pan off the stove top. You set the bottle in the hot water, and that allows it to warm up. So you warm the bottle up from the fridge temperature to the temperature you want to feed it. Feed the baby with, and then you give it to the baby. Can the baby have room temperature milk? Absolutely. So if you just mixed it, you don't have to warm it up. If the baby's used to going back and forth between breast and bottle, though, sometimes they like it warmer. They're used to getting it body temperature from mama. So sometimes they may balk at it if it's room temperature, usually not. In fridge temperature, sometimes they really will balk at it. But you can store it once mixed, not touched to the lips, but mixed for 24 hours. Once it's touched to the lips, so the baby drinks from the bottle, has a little bit left, you've got 1 hour to finish that milk. That's the formula. And so that's good to know. And then how does formula help digestive health? So a lot of times we used to hear that formula-fed babies might be more gassy. They might have different types of stools. They might not be as comfortable. Well, formulas, like I said, they're pretty smart, the companies. So formulas all have probiotics in them to kind of help with the digestive health, the creation of the microbiome in the gut. A lot of these new additions include prebiotics, which are actually what our breast milk comes with. And so the prebiotics help create those good bacteria. They kind of are the progenitors parts of what gets to probiotics. So prebiotics and probiotics, that is what the Similac Pro Advanced has those prebiotics in there, and Famil Neuro Pro has the prebiotics in there. They all had probiotics. And so generally we have found that formula-fed babies may have a different composition of bacteria, the good bacteria in their gut. They still do fine, but you know, it just kind of, these prebiotics and probiotics help the baby's guts get back to closer to those who are breastfed. We have another question. Which pump would you recommend? This is a great question, you know, so there's a lot out there. I usually don't get into brand names, but there are great ones out there. I usually do recommend a double electric pump though. And the reason is you don't have a lot of time. There's a lot out there. Some mamas who are producing a lot really like the Haka. They like to make sure they're collecting anything that's coming off the other side. I have some mommies who've told me that they really just need a manual pump on the other side. They don't have the need for a double electric pump. But if you feel like we need to help stimulate that production, which really does happen in the first few weeks, those first 4 to 6 weeks, you guys are kind of playing leapfrog. Your needs are here, the baby's needs are here, or your production's here, the baby's needs are here. And then in a few days, the baby's here and is asking you to catch up. And then you catch up, and then the baby's here, and you go there. So for 4 to 6 weeks, you're playing leapfrog. So that double electric pump is really, really helpful in those first few weeks, if not longer, when you go back to work and stuff like that, to make sure that you're stimulating and emptying completely. So this factory up here knows this is how much the baby needs, this is how much I need to produce. Overproducers or mamas who produce a lot don't want the double electric pump. They're usually very happy with the Hakas or the manual pumps. So with double electric pumps, I know a real popular brand out there that a lot of my families use is Spectra. They like the Spectra pumps. Some of my other families really like once things get stabilized after that first month, they really like using the hands-free, the LV pumps that can kind of help pump while you're walking and doing stuff around the house. So those are kind of the ones that are out there. LV and the cordless ones do not have as much of a suction as a double electric pump, and the manual one is just exhausting. So unless you know that's exactly what you need, I would stick with a double electric. Hopefully that helps answer your question. So formula feeding, formula is not evil. We need to feed our baby, and if we can't do 100% breast milk, we'll mix and match. We'll get to the fix there. All right, next thing we talk about, spitting up. So we can't feed without spitting up. You guys have probably noticed these babies spit up. So why do they spit up? Why does a newborn spit up so much? There's a few different reasons. One, they don't have control of this muscle here. So at the bottom of their esophagus, at the top of their stomach, there's a sphincter that you and I can close. We can make sure that our food stays in our stomach. That sphincter muscle doesn't have control until 4 or 5 months of age, 4 to 6 months of age. So they are naturally going to put milk down there, and a little bit's going to come up, a little bit's going to come up. If they don't burp well, that air gets trapped down there, and when that air comes out, all that milk comes out above it. They have a shorter torso. So their torso, or stomach to mouth distance, is a lot smaller. So a lot more, if a little bit comes up, comes right out. They're on a pure liquid diet. If you were drinking liquids and not eating any food, you probably would have a little bit of regurgitation as well. And they spend a lot of time laying down, right? They're flat all the time. So that's why sometimes babies just spit up all the time. So there's nothing wrong with a baby spitting up. In fact, a baby who doesn't spit up is probably the exception, not the rule. Is there a way to prevent the baby from spitting up? So this is a good question. We end up talking about it a lot in the first month of life. You want to go ahead and remember to frequently burp to help prevent that baby from spitting up. So like we talked about, the baby feeds a full 2-ounce bottle or completely feeds both sides of your breasts, and all of a sudden you burp. That air has a lot of milk to get through before it can come out on that burp, and so a lot of milk comes out. So if you're bottle feeding, I recommend burping every half an ounce to an ounce. That way a little bit of air comes out, a little bit of air comes out, and that milk can stay down. If you're breastfeeding, you definitely want to burp between sides. Remember, your milk is going to come a lot more slower and more paced from the breast than it does from a bottle. The bottle comes out real fast, so you gotta really slow that down. But there are some mamas who have a lot of letdown, and if you're noticing that that's happening, your letdown's really strong, I recommend about 2 to 3 minutes in, stop and burp, because the baby's getting a lot right away. And then go ahead and finish out that side, burp again, 2 to 3 minutes on the other side, stop and burp, and then finish it out. So you're giving the baby 3 to 4 burps in the course of a feed. The other thing we can do is to keep the baby upright after a feed. So give the baby a 15-degree angle. Hold them in your arms. Hold them up on your chest. Put the baby in a swing or something for a few minutes. But the idea is gravity, right? So if I can even give it a little tilt, give the baby a little 15-degree tilt, that milk is going to come downwards. If I lay the baby down right afterwards, chances are it's going to come up. So smaller, more frequent feeds if needed. Capping your feeds to 2 ounces if you're with a bottle, or kind of slowly pacing on the breast so that it spaces it out and makes it a little bit of a longer feed. Upright positioning and frequent burping. That's a good way to prevent the baby from spitting up. What about burps and hiccups? What does that do, or how is that related to spitting up? So burping we just talked about a lot. If we burp more, we're probably going to get less spit ups. Hiccups don't necessarily mean we're going to be spitting up, but it does mean we're full. So when a baby has a full belly, and that belly is touching up against the diaphragm, every time the baby's breathing, touching the belly, you got hiccups, you got hiccups, you got hiccups. So a full baby will tend to hiccup, which is just fine. Hiccups are normal. Sneezing is normal. Burping is normal. Periodic breathing is normal. Learning to breathe is completely normal in the first few weeks of life. But if the baby's hiccuping a lot, maybe we can try more frequent burping in between those feeds to keep the baby from getting really full, bloated, and uncomfortable. But that's how they all kind of roll together, the burping, the hiccups, and the spitting up. When does a baby need medication for spitting up? So you're like, my baby is spitting up but doesn't seem unhappy. Does he need medicine? Well, the medicines don't really keep the baby from spitting up. The baby's got to develop that muscular control. The stomach's got to start growing. Then spitting up gets better by 4 to 5 months of age. Actually, after 6 months of age, it's really a lot better. But medicines are to reduce the sting of acid. So some babies, unfortunately, when they're spitting up, the acid comes up and burns their esophagus. It kind of irritates it, makes it inflamed. So now every time there's milk coming up, they're arching their back, they're uncomfortable, they're unhappy, they're kicking up their legs, and you can tell they're hurting. So in those situations, if we've tried the smaller, more frequent feeds, if we've tried possibly changing, taking some things out of mama's diet in the breastfeeders, or changing the formula for formula feeders, if we've tried upright positioning and still it's not working, we've maybe thickened the feeds or used a reflex formula and it's still not working, then we end up at medication. We as pediatricians expect babies to spit up. We just don't want them to be in pain. So usually we'll try quite a few different things before we jump to medication or a referral. Sometimes we'll end up taking us down to a hypoallergenic formula. You may have heard about that, or a hydrolyzed formula, just to help things be broken down in the formula so that the baby doesn't have to work so hard to digest. So that's kind of where those different formulas come into play. But you'll probably be talking a lot with your pediatrician if the baby has painful spit ups. If the baby's just spitting up and happy camper, we call him a happy spitter and we go on our merry way. But spitting up is very common, and we do expect it to happen. We just have to see if we can help the baby get through that period of time until they mature from an anatomic standpoint. So we all talk about a lot of spitting up in the first few weeks of life. Crying. Why does a baby cry? You know, what's making this baby cry? We always think the baby should be happy and calm and quiet, but a baby actually cries sometimes just for no reason. So sometimes there's a reason. The baby's hungry. The baby has a dirty diaper. The baby feels hot. We've overdressed them. The baby feels like they need to be moved. They can't move yet. They don't know where all their body parts are. They're not in control of all their muscles. So they need help. They need you to pick them up, kind of reposition them sometimes. They need some love. They want some TLC. They've been in the womb for all this time. They want to be loved. So those are all reasons the baby might cry. But a baby can cry 2 to 3 hours a day for no reason, up to 5 hours a day for no reason, sometimes in the first month or so of life. And so this can be very worrisome for a lot of families. It can be very exhausting for a lot of families. So we do talk about crying a lot. We want to make sure that you feel like you're supported and that you're doing all the right stuff and you're not missing anything. So this is important for you to talk through things with your pediatrician. This is what's going on. This is how the feeds are going. This is how the poops are. And we'll talk about poops in a minute. This is how the burping is. Because after all of that being normal, if the baby's doing well, growing well, and appropriately feeding, then it comes down to maybe this is just a baby who's going to cry a little bit. And after the first couple months, things get a lot better, but that's a very long couple months for you guys. So crying can be normal. Crying can mean there's something going on, and if we've checked all those things off and we find out the baby is just crying, sometimes we just have to hang tight with the baby and get through those moments. Do colic and gas make a baby cry more? So gas doesn't always make a baby cry more. Some babies, especially breastfed babies, are just gassy. They're just passing a lot of gas, loud gas, and they could care less. That doesn't always make them cry more. If it's hurting them, if they're pulling their legs up into their belly, if it feels like it's painful or they have to push really hard to get the gas out, sometimes you'll talk to your pediatrician and they'll want you to see if we need to change anything in mama's diet or in the formula. Colic is a lot of crying, and that's actually a diagnosis. So not all cranky kids are colicky. Colic usually starts around 3 weeks of age. It lasts till about 3 to 4 months of age. It's identified as 3 or more hours of crying on 3 or more days of the week without reason. This baby does well during the day, feeds during the day, sleeps during the day, is a happy camper, and then evening comes around the same time every day or whenever it's going to happen, those 3 or 4 times in a week, boom, the baby starts crying. Top of the lungs, can't control it. Sometimes you swaddle it, it helps. Sometimes you hold and swing and it helps. Sometimes you give the baby a bath and it helps. Sometimes you soothe and shh and it helps. Sometimes you take the baby for a drive and it helps. But not the same thing helps every time. So colic is a very exhausting kind of period of time. If a baby does have colic, more so for the parents, it's exhausting, not so much for the baby. But it's just part of development. It's part of their nervous system developing. It's part of their gut maturing. It's a part of a lot of different things going on in that baby's body as he or she gets used to the world out there. So colic is not uncommon. Colic is exhausting, and there's nothing really that we can do to resolve the colic. So it's not always driven by gas. So, okay, I'm going to give him gas drops. I'm going to give him gripe water, and that's going to help. Sometimes we just have to get through it. Colic will peak by a couple months, and then it'll start getting better and will resolve by 3 to 4 months of age. So colic does get better. There's light at the end of that tunnel. What about crying it out? When can you let your baby cry it out? Definitely not in the first month of life. That baby is crying, sometimes for a reason, sometimes not for a reason, but cannot soothe himself or herself. So the baby does need you to kind of tend to him or her if they're crying. Sometimes if you know it's a colic spell and you know it's exhausting and the baby's just going to keep crying for a little bit, and you can't handle it, we'll say put the baby in a safe space in their bassinet or their crib, walk away for a few minutes, go wash your face, go get a drink of water, come back to the baby, keep the monitor on the baby, maybe 5 to 7 minutes at most, 10 at tops. But the reality is yes, you've got to survive too. But crying it out or waiting for the baby to stop crying at this age is not appropriate. The baby doesn't know how to self-soothe until about 4 months of age. So right now, crying requires your attention. Even if you give yourself a few minute break, it's okay, but we got to make sure that we take care of the baby. How long can a newborn cry? We talked about that, 2 to 3 hours at a time on most times. And then otherwise, sometimes up to 5 hours. So we will keep chugging along here. Sleep, how long does a newborn sleep? Up to 17 hours a day. So wakes up, feeds, looks around for a few minutes, and then goes back to sleep. And so that's normal for a baby to sleep 14 to 17 hours a day. And then the question that comes up is, when will this baby sleep through the night? There's a lot of parents who swear their baby sleeps through the night by a month of age. It just is not true. A baby usually sleeps about a 4-hour stretch by 2 months of age, 6 to 8 hour stretch by 4 months of age, and an 8 to 10 hour stretch by 6 months of age. So we've got a few months to work on over there. So the circadian rhythm, the days and nights, aren't even clear to a baby until about 4 to 6 weeks of age. Some babies sooner than others. Some babies who don't have colic, don't have a lot of the gassy discomforts or intestinal issues, they do sleep a little bit longer earlier, but the majority of my 2-month-olds are sleeping about 4 to 5 hours at night at a stretch. After that, they go back to their 2 to 3, 2 to 3, 2 to 3. Can a baby sleep on their side? And we recommend no, because a baby who sleeps on their side might turn over onto their face. So we don't want that to happen. And so always put the baby on their back to sleep. Side and belly sleeping is not how we want them to sleep. We want them to be with you on their side and belly. So you can hold them on their side, you can hold them on their belly. When you're watching them, they can lay with you in that position even if they're asleep. But when you put them down in their bassinet or crib, make sure they're on their back. What do we say about co-sleeping? We don't recommend co-sleeping, but we do recommend room sharing till at least 6 months of age, if not 1 year of age. Room sharing, but not bed sharing is what we say. So the baby's in your room, you can watch the baby, you can kind of take care of them if you hear some noises or you feel like they're not moving or jarring or they're moving up against the side of the bassinet or the crib. And that has reduced the risk and the incidence of SIDS as well. So sleep. And then pees and poops. How often does a baby pee? In the first day of life, just once. Second day of life, twice. Third day of life, 3 times. And eventually, once mama's milk is in, gobs and gobs of times, 5 to 6 to 8 times a day. But in the first couple of days, we're not expecting a lot of pee-pee. What color are baby stools? Come out black, tarry initially, turn to green, slimy, transitional stools, and then eventually yellow, seedy, mustardy stools. They look like little squirts of liquid mustard. So what if a baby has loose stools? It might actually just be breast milk poops. So nothing to worry about. Formula-fed babies tend to have a little bit more texture to their poops, more like wet mud, still brownish, greenish, yellowish, but loose stools don't always mean an infection. It could mean that we're just having normal newborn poops. Should you track urine and stool output? In those first couple of weeks, especially, yes, because the baby is still figuring out how to eat and drink. The baby's gut is still trying to get rid of old poop before they make fresh poop, and their kidneys may not be, or their body may not be well hydrated, so their kidneys have got to start working to get that urine out. So especially in the first couple of weeks, let's track those urines and stools. How fast does a baby gain weight? A baby can gain ½ an ounce to an ounce a day. And so a lot of times by the first month of life, they'll have gained 2 pounds. If they gain an ounce a day, if you think about it, that's 30 ounces, which is almost 2 pounds. So there is a lot of room for gain there. But just remember, a baby initially loses weight at birth. And the reason they lose weight is because they come hydrated with extra water weight. So when they come extra hydrated, they pee it off. They're waiting for mama's milk to come in. That's how nature makes them, gives them an extra hydration, so that until mama's milk comes in, they're hydrated. hydrated. But initially they lose weight and they'll regain that birth weight by 7 to 14 days of age. What role does cluster feeding play in weight gain? It is really important. So remember, cluster feeding is the baby's way of saying, I need more. So baby wants to feed, 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 half an hour later, feed, feed again. But it's also telling mama's factory to produce. So cluster feeding helps mama's production, and it also helps the baby gain weight. You'll notice a lot of cluster feeding in the first couple of weeks of life, usually till the 3-week growth spurt, and we see that. And then after that, sometimes it levels out, comes back again around the time of growth spurts, but usually after the first month, cluster feeding does level out a little bit. Can you overfeed a newborn? You can with the bottle. Is it bad? Not necessarily, but sometimes we have linked overfeeding in those first couple of weeks to trends for obesity later on in life. I don't want you to put your baby on a diet. That's not what we're saying. But just be aware that a baby needs about an ounce for an hour. So especially a normal average size baby will feed about 2 ounces every couple hours, and that's what you're aiming for. Not 4 ounces yet. They will take it. If they're suckling on the nipple, it's soothing to them to suck. Their belly will grow to accommodate it, and all of a sudden we've overfed the baby. But we'll figure things out. And so usually I want you to talk to your doctor, and that's why we track everything. We track their weight, we track their height, their head circumference, we track everything. So just being aware of that. A baby will get their first bath in the hospital, and a lot of times now the recommendation is to wait for the first 24 hours. So if we can, from 6 to 24 hours, we'll wait to bathe the baby, and the reason is that Vernix is protective against bacteria. It helps protect the skin. It also gives that time for the baby and mama to bond, and in that time. So sometimes we'll delay that first bath, but we've seen that it is protective in that way. We cannot put the baby in a bathtub until the baby's belly button stump is off. And if the baby's been circumcised with a plastibell, the plastibell has to be off. So usually a couple weeks of sponge bathing before we can go in the baby bathtub. How often should a baby be bathed? Every 2 to 3 days is fine. So 2 to 3 times a week is just fine. And then as they get a little bit older, as they start having more heat outside in the summertime, you'll bathe them more often. And I usually don't start any lotion for that dry skin you see right at birth. Babies are born, especially term babies, with dry, flaky skin. Lotions and creams we wait on until a few weeks of age, and that's because their body doesn't need it. And so their body will start producing their body oils by 2 to 3 weeks of age, and you'll notice the dryness goes away. So in the first month, probably not too much lotion. And even when we do, no scented lotions, all hypoallergenic stuff, without scents, without fragrances, without colors and dyes. They just need the basic stuff to keep their skin hydrated if we think they need it. And talk to your doctor to see if your baby's ready for lotion. Can visitors come over to see the baby? I usually say a few visitors at a time, so not a whole group of people, making sure they're not sick. Nowadays, I've been telling everybody, have them wear their mask. No one's going to be upset if you ask anybody to wear a mask nowadays, but we just have to remember that a baby can't fight infections the way older kids can or the way adults can. Their immune system is very young, until 2 to 3 months of age. We want to make sure we're keeping them very safe and protected. So a few visitors at a time, making sure they're washing their hands, making sure they're not sick. What if everyone wants to kiss the baby? I don't recommend anybody kissing the baby, especially on their face or their nose. If little kids do, or if grandparents want to, I usually recommend on the forehead or on the back of the head right here, just so that we don't get any germs near the mucous membranes. When can a baby be in crowds or gatherings? I usually wait for 4 to 6 weeks, and if longer, if you can. A baby is considered a high-risk infant till 2 to 3 months of age. I don't want you giving Tylenol to the baby without asking your doctor till the baby's 4 months old. So the reality is, if something's going on and the baby's not acting right, the baby's really fussy, you can't calm them down, really sleepy, you can't wake them up, doesn't want to feed, or has a temperature higher than 100.4 degrees Fahrenheit, we need to know. I don't want you giving Tylenol because we may not know why the baby is not acting right or has a fever. So crowds and gatherings, avoid if you can. Small groups, possibly. People that you know and are familiar with and you know are healthy is the best. A baby will not smile or coo at you until 2 months of age. So what's happening right at birth? It's a spontaneous smile. A baby smiles because that's just the way they are. Their muscles are moving that way. But as far as vocalizing and as far as socially responding to you, that's 2 months old. And then when should the baby start tummy time? You can start it right at birth, actually, is what they say, and that's not on an activity mat. That's with you. So on your chest or on your lap, as you're holding the baby up like this, that's still tummy time, if you will. They're still learning to strengthen their back muscles in that position. So, so you can definitely do tummy time in that form. Now, the tummy time we think of putting them on an activity mat, if we think about it, they don't have that neck control until 2 months of age. So on you, with some support for the first 6 weeks of life. And by 2 months of age, you'll notice you put them on an activity mat, they'll kind of move their neck in that direction. 3 months of age, they'll start lifting their shoulders. And by 4 months of age is when they kind of get their little hands underneath them like this. So tummy time should start to strengthen those back muscles sooner than later, but not necessarily the full form of tummy time. Should I keep my baby up during the day? Babies don't know days and nights initially when they're born. Circadian rhythm kind of sets in by about 6 weeks of age, 4 to 6 weeks. So I don't necessarily recommend pushing the baby to stay awake in that first month of life. There really are no routines and schedules in that first month. The baby has a lot of metabolic growth and development going on. So we just kind of have to follow the baby's cues. But we don't want to overstimulate or exhaust the baby because then it'll be harder for the baby to go to sleep. Does the baby respond to sound and voice immediately? The baby knows voice, human voice, sounds, doorbell rings, they'll turn in that direction. And that's normal. And they were used to hearing you in the womb too, when you were talking, singing, reading books. So you can start all of that right off the bat. And so kind of those are the big things, and there's a lot of things that could come up, but pearls for the first month and just kind of stuff we talked about. There isn't one right way to nurture a newborn. Read your books, read your blogs, be open to knowing that the baby may do things differently, and use your resources, right? So it takes a village to raise a child, grandmas and grandpas, aunts and uncles, friends, lactation nurses, doctors, everybody else out there. Mamas, I recommend you sleep when the baby sleeps. If I told you the baby slept 17 hours a day, I know you're not getting 17 hours in that first few days, but try and take those naps. Everything else to get done, but you resting is a big factor in producing milk and taking care of your baby and being healthy for both of you. And like we said, use your resources. Would love to entertain questions if you have any. And if not, then we'll finish this up. But I thank you guys for your time. And hopefully one day we'll meet you guys with your babies. Take care.